Hi, my name is Christopher Cox, and this week for my video, I'm going to talk about ACLS algorithms. Now I have a two-part video. My first video, I'm going to talk about pharmacology and hemodynamics. My second video, I'm going to talk about shock. Now before we get started, I'm going to draw the different waveforms we might see. Now there's four we're going to talk about, and that's the four I'm going to draw. We have V, fifth, V, tach, we have asystole, and we have pulseless electrical activity, which we call PEA. So now I'm going to draw V-fib first, and V-fib kind of looks like this. V-fib. Now V-tach is a lot wider. And that is V-tach. Asystole is the easiest one to draw. It's just a flat line. And now I'm going to draw PEA for us. Now PEA looks like that. So now that we have all our waveforms, we can start talking about our drugs. Now, in our algorithms, we have two that we're going to talk about. We have the pulseless V-tach, V-fib, and then you have your PEA and asystole. So with both, what is common is we always use O2 oxygen. That's a given. Now, we also use epi and vasopressin in both. Now, that's all we use for the PA asystole. But with the V-tach V-fib, we also use amiodarone and lidocaine. So there's the difference. We can compare and contrast. And now we're going to talk about our drugs. So first, the V-tach V-fib is the one we're going to go through first. We use oxygen. Now, oxygen, we use our resuscitator bag. We're bagging. It's breathing through the patient, by the patient, and gas exchange happens in the capillaries. Now, after gas exchange, oxygen binds to hemoglobin and is carried throughout the body. Now, if we have adequate blood flow, we're going to have adequate supply of oxygen to the tissues. So we have this, we have normal hemodynamics, we're going to have a normal sinus rhythm. Now we go to epi. Now, the dose for epi is 1 milligram. And we get that every 3 to 5 minutes. So that's something we want to remember. Now, epi is a vasoconstrictor, and this may improve cerebral perfusion. Epi also binds to alpha-1 adrenergic receptors of blood vessels. These are found in our arteries, our veins, and this causes direct vasoconstriction. This increases perfusion pressure to the brain and heart. Epi also binds to beta-1 adrenergic receptors of the heart. This indirectly improves cardiac output by increasing the heart rate, increasing the contractility of the muscles in the heart, and it also increases the conductivity through the AV node. Now this returns us to our normal sinus rhythm. Now vasopressin, 40 units, can also be used to replace epi. And vasopressin is found to have the same effects as epi. Now our next drug is amiodarone. Amiodarone, its dose is 300 milligrams by rapid infusion, and then it's given in a dose of 150 milligrams every 3 to 5 minutes. Now, amiodarone is an anti-arrhythmic drug. Now the mechanism of action is actually not known, but it's used during the code for those who are unresponsive to shock delivery, CPR, and vasopressors. Now, our last drug for the VTAC, VFib, is lidocaine. And that is given in a dose of 1 to 1.5 milligrams per kilogram, and that's given through IV or intraosseous. That's that. So lidocaine is also an antiarrhythmic drug. And how this helps us restore hemodynamics into a normal sinus rhythm is that it suppresses the abnormal firing of pacemaker tissue, or it depresses the transmission of impulses in tissues that either conduct too rapidly or participate in reentry. So here we have stability, and that's what it provides for us here. Now we can move on to our next algorithm. We have our PEA in asystole. So here we give oxygen, and it's going to do the same thing, same goal here. Now epi we give, it's going to be the same dose of the 1 milligram every 3 to 5 minutes. And here what we're trying to do is trying to increase that heart rate, because we know we have that black line that pulses electrical activity. So we're trying to increase our heart rate, and we're trying to increase that muscle contractility in the heart. Because if we have that, we're going to get back to that normal sinus rhythm that we're looking for. And we also use vasopressin to replace epi if it doesn't work. And also we can use atropine, but that's not used anymore. They took that off in 2010, but that's always just something to keep in mind. That's something they used to use. Now these are the drugs that we use, and that's the end of my first video. The sources I use our Scanlon book, I use www.aclsalgorithms.com, and I also use the ACLS guidebook that's provided by the American Heart Association. So thank you for watching, and in my next video I'm going to talk about shock.